As many of you know, Surescripts operates the nation's largest e-prescribing network, and we're very thrilled and excited about the adoption and usage of e-prescribing over the past few years. Today, we are announcing that we are opening up our e-prescribing network to handle more than just e-prescribing messages. And specifically, we'll be moving clinical information, clinical messages.
So my name is Chris Ross. I'm responsible for the Clinical Interoperability Services business at Surescripts, and I'm really pleased to have this panel here with us today. But what we really want to do is to understand if we create this kind of low-cost, efficient, open backbone network, how would our partners define how it would be used?
So I see what you've announced this evening as incredibly complementary to all the activities that we have with federal and state HIEs that are emerging. And to me, this is really going to accelerate our work to get into that last mile, especially the small provider office.
And I'm really impressed by how practical a move this is. This whole effort to get information of a clinical relevance from one physician to another physician is incredibly important and very, very practical, and will have almost immediate results. And yet the number of physicians who can reliably and securely send a message to another physician in the same community, unless they're on the same electronic health record, is zero. A lot of that exchange right now is occurring via email in the clear. You'd be surprised how many physicians are communicating with other physicians about their patients in the clear using email. That's really not an alternative. It's not secure enough. It doesn't work. But I think what Surescripts is doing here, announcing tonight, is a really big step forward.
I'm a practicing oncologist, and when patients come and see me in consultation from other practices, they deliver their records by SneakerNet. They basically put them under their arms, carry their x-rays, take the piece of paper, put them on my desk, and expect somehow or another during that consultation of 30 or 40 minutes, I will have reviewed all that information. By the time all the stuff is in front of you, what you're actually missing is a pathology report, the only thing you're actually looking for, and then you start a chain of phone calls. So clearly the current system does not work outside of one organization. So I'm extremely excited that we will have the opportunity to work with other providers in this push technology where information will automatically come into our EMR and be able to be consumed, which will dramatically improve and really be transformative in how we do healthcare.
It is leveraging these exact kinds of approaches that the NHIN Direct, the federal program, has already vetted and has already achieved some consensus. So, in effect, what you're doing is creating some plug-and-play components that leverage the work that has come before you.
I just came back from the American Academy of Family Physicians Annual Scientific Assembly, which is our large meeting, and we have about 5,000 physicians attend. And our physicians are just focused like a laser on meaningful use. They're just as tired as we are as patients of the inefficiencies of the healthcare system. And one piece that's very, very important to that is how do I connect with my colleagues? Even those physicians who have electronic health records are going to be interested, I think, in participating in this new venture that Surescripts is launching now, or at least many of them will, because they're not always in the position of having those services delivered by their electronic health record company. They're also not always available through an HIE. So this is just one more choice, one more option for physicians have to make that connectivity.
So often organizations look at the ability to exchange information within their systems. Yes, they can communicate to other physician practices, but only if they're within the same health system. Yes, they can communicate to their hospital, but only if they're part of a hospital-based practice. The opportunity to exchange information between providers will affect how care is delivered, has the potential to change not only how physicians deliver care, but also to reduce the cost of self-services. We cannot afford not to modernize our communications. Many practices looking at electronic health record, it is such a huge endeavor that they're concerned about the economic cost, but there's a greater concern, and that is fear of failure. I think this is where the opportunity where Surescripts has come in to provide the network is reputation. That an organization that has reputation and has a proven track record, in your case, in the exchange of pharmacy data, and prescriptions to bring that into the open exchange of clinical information through a secure network, I think is a very critical aspect of expansion.
The amount of pages and faxes and communication that occurs because of lack of coordination probably wastes 20% of a clinician's day. So this kind of approach of information sharing, information or data liquidity that makes it very, very easy for the primary care physician and specialist to close the loop reduces wasted time. So it's 2015, and it is accountable care nirvana. So what happens? The market evolves decision support service providers to turn data, information, to knowledge, to wisdom. So what you hope is we aren't just exchanging data. We are actually delivering to the patients and to the doctors the wisdom they need to ensure the exact right care is delivered at the exact right time.
I think this technology is an excellent opportunity with a quality vendor and an excellent partner to begin to drive information in the right place at the right time.
So we have the opportunity to utilize new technologies, we have the opportunity to have secure communications, and we give the doctor less confusion so they can work more efficiently and better. Mm-hmm. You know, 5 years from now, we could be doing many different things, and we'll do them better, mm-hmm. and we'll do them cheaper.
I'd like to just ask you to join me in thanking our panel for a great discussion this evening.